Last October, Douglas Crawford began having painful cramps in his legs, hallucinations, and memory loss. The symptoms seemingly appeared overnight. His condition worsened rapidly, and soon he was confined to a wheelchair. He wasn't sleeping, and muscle spasms were causing such violent jerks he was falling constantly, out of bed and out of the wheelchair that now confined him. With only memory loss and confusion, it would have been easy to diagnose the 85-year-old with some type of dementia, or with just the physical symptoms, he could have been diagnosed with neuropathy. But because his mental state altered so suddenly, physicians knew it had to be something more. They were just not sure what could explain all the symptoms.
It was a scary time, and it was something that nobody understood. The emergency room doctors, the hospitalists, family doctors, nobody could put a name to this.
The couple had been active before this illness and comfortable in their cottage at Grace Ridge Retirement Community, where they had lived for 20 years. Both have enjoyed relatively good health, but Mr. Crawford's illness landed him in the hospital several times and in the assisted living unit at Grace Ridge. Mr. Crawford's hallucinations were particularly problematic.
But I was all over this country at one time or another. I was with a facility in Phoenix, Arizona, which was part of the Grace Ridge system.
Took you to a cat show one night.
Yes, it did. Thinking about them now, you know that they couldn't possibly have happened, but at the time they were just as real as anything.
The situation began to change when Dr. Kadry Allaboun, MD, a neurologist at Blue Ridge Healthcare, began investigating Mr. Crawford's case in November. After many tests and extensive workups, Dr. Allaboun realized why Crawford's condition was so hard to explain. He diagnosed Crawford with Isaac's syndrome, a very rare autoimmune disorder that is easily confused with many muscular degenerative and neurological degenerative diseases.
We were thankful that Dr. Allaboun came on the scene when he did, because it was as if he had been sent here to help us. He had one time before seen a case of this that had been previously diagnosed. It was that rare.
Crawford presented symptoms affecting both his central nervous system, brain and spinal cord, and peripheral nervous system, spinal cord to muscles. The hallucinations, confusion, and memory loss stem from the attack on nerves in the central nervous system. The muscle twitches, fatigue, weakness, and difficulty walking were due to the peripheral nerves being attacked.
This disorder, it is rare. It is an autoimmune disorder. The immune system starts producing antibodies against the voltage-gated potassium channels randomly. But they noticed that patients with history of cancer, like colon cancer, prostate cancer, which Mr. Crawford had in the past, he had previous prostate surgery, and patients with thymoma, which is mass and a tumor in the thymus gland, they have higher risk of having autoimmune disorders and paraneoplastic disorders in the future.
The confusion, memory loss, and hallucinations meant Mr. Crawford wasn't able to give an accurate medical history or symptoms.
They have memory loss, and you need a family member who would really very observant to tell you the patient has other symptoms like insomnia. They don't sleep well. They stay awake most of the night. They have fatigue during the day because they don't sleep well. She was really great, very helpful. I mean, she answered all these detailed questions. She's very observant. I never gave up, and she never gave up. So we kept thinking, and we kept doing all the blood tests and the workup, try to find out, putting all these pieces together. When you find someone with just memory problem and confusion, you don't want to diagnose with this patient with dementia or Alzheimer's disease, which he doesn't have.
Mr. Crawford endured many tests and time in the hospital while Dr. Allaboun ruled out other causes of his symptoms, encephalitis, meningitis, dementia, etc. He underwent an electromyography, EMG, where a small needle is inserted into the muscle and the electrical activity of neurons is recorded. Finally, he underwent a lumbar puncture to capture spinal fluid for testing. The fluid was sent to the Mayo Clinic in Rochester, Minnesota, one of only 3 labs available in the country to conduct the extensive panel Dr. Allaboun needed to make a diagnosis.
And that came back positive. And that took about 2.5 months maybe before they finally ran that down. The first symptoms appeared on the 31st of October, Halloween, so we can remember that. And it was not until close to the middle of January, I guess, when we finally got a diagnosis.
Mrs. Crawford said it would have been easy for the doctor to give up on her husband.
There are a lot of doctors who, after all these weeks and weeks of nothing, would have said, well, you know, he's an older man, let's keep him comfortable, and we just don't know. But he didn't quit.
Thankfully, that was not Dr. Allaboun's approach. Isaac's syndrome can be treated, but it is considered incurable. For Mr. Crawford, the treatment that worked best for him included receiving immunoglobulin through an IV. This required 5 days of 4-hour treatments at the infusion center at Valdez Hospital.
After the infusion, the improvement was pretty dramatic.
Mr. Crawford still has some pain in his feet, and it hurts more to stand than to walk. But he is walking without the aid of a walker.
So physical therapy is very important to keep his strength, his function, and doesn't lose the muscle strength and the size of his muscles, so he didn't have atrophy or weakness. But the good thing is most of them, they do well with therapy, with physical therapy, and if their symptoms recur, at least you know the diagnosis and know how to treat them right away.
At his last appointment with Dr. Allaboun, Mr. Crawford was able to remember all of his family members and discuss his condition. For the Crawfords, finally having a diagnosis brought peace of mind.
Dr. Allaboun, we sing his praises to the sky, obviously. He didn't give up. I mean, he continued until he found an answer to our problems. He kept touch with me regularly. We called each other on cell phones. He even gave me his cell phone number so that he was available to me at all times. He was wonderful about answering questions. And there were times when, of course, he didn't know the answers either. But he was honest about that, and I understood that. He was a real source of support and strength.
I'm very pleased and excited that I got to help Mr. Crawford, because you couldn't imagine how stressed they were. I mean, the family, the wife, they were, of course, like all of us, you know, a family member who's very smart, intelligent, suddenly start having these symptoms. I got to help a person who's healthy, you know, doing very well, smart, intelligent, start having all these symptoms. You know, very concerning. He was really going downhill with his memory, with his motor strength, and finally, when we knew the diagnosis, we got to help him and make him feel better.
Today, Mr. Crawford can be found walking along the Catawba River Greenway. I'm up to a mile, he said, smiling. I enjoy that.